In recent years, a new class of medications has completely transformed the way we approach both type 2 diabetes and obesity. Drugs like Ozempic, Wegovy, and Mounjaro have become household names, celebrated for their remarkable ability to help people lose significant amounts of weight and bring blood sugar levels under control. These medications belong to a group called glucagon-like peptide 1 or GLP-1 receptor agonists. Their popularity is not just based on anecdotal success stories. Clinical trials have shown they can dramatically improve health markers, offering hope to millions who have struggled with these chronic conditions for a very long time. So, how do these drugs work their magic? Essentially, they mimic a natural gut hormone called GLP-1. This hormone is released after you eat and plays a crucial role in managing your appetite and blood sugar. By activating the same receptors, these drugs tell your brain you are full, which reduces your food intake. They also slow down the speed at which your stomach empties, prolonging that feeling of satiety. Furthermore, they stimulate the pancreas to release insulin when blood sugar is high, helping to manage glucose levels effectively. This powerful, multi-pronged approach is why they are so effective for both weight management and diabetes control. However, as with any potent medication, the scientific and medical communities are constantly monitoring for potential side effects. While common issues like nausea and digestive upset are well known, recent attention has turned to a much rarer but more serious concern: a possible link to sudden and often permanent vision loss. This has sparked a great deal of discussion and new research as doctors and patients work to understand the full safety profile of these groundbreaking treatments. The central question is whether these drugs, in very rare instances, could contribute to a devastating eye condition that affects the optic nerve. The conversation is not meant to cause panic, but rather to encourage awareness and informed decision-making. The benefits of these drugs, including a reduced risk of heart attack, stroke, and the complications of obesity, are substantial and well documented for most people. The goal now is to identify if a very small subset of individuals might be at a higher risk for specific adverse events, like vision problems. Understanding this potential link is the first step toward creating safer treatment plans, ensuring that the right patients receive the right care while being monitored for any unlikely but serious side effects that could arise during their treatment journey. The specific condition at the heart of this concern is called non-arteritic anterior ischemic optic neuropathy, or NAION for short. While the name is a mouthful, it is often referred to more simply as an eye stroke. This is a fitting description because, much like a stroke in the brain, NAION occurs when blood flow to a critical part of the eye is interrupted. In this case, the blood supply to the front part of the optic nerve is blocked. The optic nerve is like a data cable connecting your eye to your brain, transmitting all the visual information that allows you to see. When it is starved of oxygen and nutrients, its delicate nerve fibers become damaged. The onset of NAION is typically sudden and, importantly, painless. A person might wake up one morning to find that the vision in one of their eyes is significantly blurred, dim, or has a large dark spot, often in the lower half of their visual field. It usually affects only one eye at a time, though it is possible for the other eye to be affected later on. Unfortunately, the damage caused by this loss of blood flow is often permanent. There is currently no effective treatment to reverse the vision loss from NAION, and studies suggest that around 70% of people who experience it will not see any significant improvement in their sight. Certain individuals are naturally more susceptible to developing NAION than others, even without taking any specific medication. The primary risk factors are pre-existing medical conditions that affect blood vessels, such as type 2 diabetes, high blood pressure, and high cholesterol. Obstructive sleep apnea is also a known risk factor, as it can lead to drops in oxygen levels during the night. Another key factor is anatomical. Some people are born with a small, crowded optic disc, which is the point where the optic nerve enters the back of the eye. This anatomical feature leaves less room for the nerve fibers and blood vessels, making them more vulnerable to swelling and blockages. Understanding these underlying risks is crucial when we consider any potential new triggers, including medications. The question researchers are asking is not whether GLP-1 drugs cause NAION out of the blue, but whether they might slightly increase the risk in people who are already predisposed to the condition. It is a complex puzzle where genetics, existing health issues, and now, potentially, a medication's side effects all intersect. For patients and doctors, identifying these pre-existing vulnerabilities becomes the most important step in assessing the overall balance of risk and reward before starting a new and powerful treatment. The scientific investigation into the link between GLP-1 drugs and NAION has produced a mixed and evolving picture. Early signals raised some red flags. For instance, a notable study from 2024 suggested a worrying connection, finding that taking semaglutide for diabetes increased the risk of developing NAION fourfold. The same study indicated that for patients using it primarily for weight loss, the risk appeared to be almost 8 times higher. This research, along with case reports, prompted regulatory bodies like the European Medicines Agency to take action. In June 2024, they concluded that NAION was a very rare side effect, occurring in perhaps 1 in 10,000 users, and mandated that it be listed on the drug's safety label. However, more recent and larger studies published on August 12, 2025, have provided a more nuanced view, seemingly tempering some of the earlier alarms. One of these new studies, which looked at nearly 160,000 people with type 2 diabetes, did find a small but statistically significant increased risk. In the group taking GLP-1 drugs, 0.04% of patients developed NAION, compared to just 0.02% in the control group. While this is technically a doubling of risk, the absolute numbers remain extremely low. This study also noted a slight increase in other optic nerve disorders, suggesting the effect might not be limited to just NAION, but the overall risk is still very small. Confusing matters further, a second large study, also released in August 2025, came to a different conclusion regarding NAION. After analysing data from 185,000 people, it found no increased risk of an eye stroke among those using GLP-1 agonists. Interestingly, this study did find a small increase in cases of diabetic retinopathy, a condition where diabetes damages the blood vessels in the retina. This is thought to happen because the rapid drop in blood sugar caused by the drugs can initially destabilize these fragile vessels. This finding aligns with existing knowledge about the short-term effects of intensive glucose control on the eye. Despite this initial worsening of diabetic retinopathy, the same study delivered some very good news. It found that, over the long term, patients on GLP-1 drugs actually experienced fewer sight-threatening complications and required less invasive eye treatments compared to those on other diabetes medications. This suggests the overall benefit to eye health might be positive. So, while the evidence on NAION remains conflicting, the broader picture indicates that for most patients, particularly those with diabetes, these drugs may ultimately protect vision by improving the underlying disease that causes so much damage in the first place. Given the current state of research, the key takeaway is not to abandon these highly effective medications, but to proceed with caution and awareness. The first and most critical step is open communication between the patient and their doctor. Before starting a GLP-1 drug, it is vital to have a thorough discussion about your personal health profile. Do you have multiple risk factors for NAION, such as long-standing diabetes, high blood pressure, sleep apnea, or a known crowded optic nerve? If so, you and your doctor must carefully weigh the significant benefits of the drug against the very small but potentially serious risk to your vision. For anyone taking these medications, regular and comprehensive eye exams become even more important. It is essential to inform your ophthalmologist or optometrist that you are using a GLP-1 agonist so they can be particularly vigilant. A standard eye exam should include a dilated fundus examination, where the doctor looks directly at your optic nerve and retina. This allows them to check for any early signs of trouble, such as swelling of the optic disc or changes related to diabetic retinopathy. Establishing a baseline and monitoring for any changes over time is a powerful tool for catching potential issues before they become severe problems. Perhaps the most crucial piece of advice for patients is to be alert to any changes in their vision. The primary symptom of NAION is sudden, painless vision loss or blurring in one eye. If you experience this, you must seek immediate medical attention. Do not wait to see if it gets better on its own. Go to an emergency room or contact your eye doctor right away. While there is no cure for NAION, a prompt diagnosis is essential to rule out other treatable conditions and to manage your overall health to protect your remaining vision and your other eye from being affected in the future. In conclusion, the current consensus is that the overall risk of vision loss from GLP-1 drugs is very small, and for the vast majority of patients, the benefits far outweigh the risks. These medications are powerful tools for managing obesity and diabetes, which themselves pose significant threats to eye health. The ongoing research, including a major 5-year clinical trial, will continue to clarify these risks. Until then, the path forward is one of partnership. Patients and doctors must work together, stay informed, conduct regular checkups, and make decisions based on individual health needs, ensuring that treatment is both effective and safe.